Hello, my name is Asia Green, and in this video, we will be administering insulin to the patient. I will go in, introduce myself, ask the patient to state their name and date of birth. The patient stated their name and date of birth to me. I would perform hand hygiene, and I would don clean gloves, explain to the patient that I have an order to give them insulin for their past glucose reading of 252. My order reads regular insulin 6 units, NPH 16 units. Okay, the patient, I will assess the patient for signs and symptoms of hypoglycemia, the last time they've eaten, or if they're ready to eat something now. I will also assess the last site that they got insulin in, and I will assess them for new areas to inject. Subcutaneous areas that you could give subcutaneous injection would be the abdomen, your thigh area, the backs of your arms. Okay, the patient said that their last injection site was on the back of the arm, and they stated they want their new site to be the thigh area here. So I will go and do my first check here. So I have regular insulin, 6 units. We're going to roll the vial. And then I have 16 of NPH. We're going to roll the vial. Okay. So then what I'm going to do is I'm going to inject 16 units of air into my cloudy first. So we're going to draw back 16 units of air. All right. So we're going to inject that into here. Then we have 6 units of regular, so we're going to draw back 6 units of regular. Draw that into here. We're not going to pull back the needle. Now we're just going to flip in 6 units, being sure not to put any air into the syringe. I have my 6 units. Okay. And then we're going to get 16 of my NPH, and this is going to give me a total of 22 units. So we have our 22 units here, being sure not to inject anything back into this vial. So now what I'm going to do is safely recap the needle. So I'm going to pull it back here so you can see. We're going to safely recap the needle. Needle is recapped. If I was not in the patient's room, I would label the syringe, but being that I am in a patient room, I do not need to. So we're going to do another check here. We have regular insulin, 6 units, and we have NPH, 16 units. I have asked the second nurse to verify this. The nurse has verified. So then I'm going to turn to my patient. For safety for me, I will ask the patient to state their name and date of birth once more, just to be sure again. The patient stated their name and date of birth. We're going to do our third check here. Regular, NPH. Again, the patient stated that they want their thigh area, so I am going to clean with my alcohol swab here. We're going to clean in a circular motion. Allow it to dry. If I could pinch 1 inch, I would go at a 45-degree angle. If I could pinch 2 inches, I would go at a 90-degree angle. But I think I can only get about 1 inch pinch here. So we're going to take the cap off. I got 1 inch. I'm going to go at a 45-degree angle. 1, 2, 3. And we're going to inject slowly. We're injecting slowly here. Draw back, pull up my safety, dispose of this in a sharps container, take an alcohol swab, and gently press. All right, this would be in a sharps container, but for now, we're just going to lay it here on the table. I will then take off my gloves, perform hand hygiene. I will document how the patient tolerated the injection. I will document the site and the amount that was given. Thank you.